So welcome back to another webinar from the webinar series organized by Princeton University's Bendheim Center for Finance. We're very happy to have Joseph Stiglitz with us today. Hi, Joe.
Hi.
So Joseph will talk about the US response to the COVID crisis, and we will learn a lot from him. Before we go into his presentation, I would like to say a little bit about the last Friday's presentation. Harold James was talking about debt monetization. What can we learn from war financing? And on Friday, Michael Kramer will talk about the development of vaccines and diagnostics. How can we encourage people and companies to speed up the vaccine creation and the diagnostics? And there's a list of speakers. You can see them here. If you want to learn more about it, about the upcoming webinars and the past webinars, the YouTube videos, just go to our website, bcf.princeton.edu. Let me give you a little bit of an introduction to the topic today. We're essentially experiencing a naked swimmer moment, as Warren Buffett put it. He says, oh, when the tide goes out, you figure out which swimmers are swimming naked. And the crisis is essentially revealing some hidden strengths and weaknesses of various governments and societies. And of course, the strengths and weaknesses, some of them are previously established governance and institutional structures. And some of it is how can you manage the crisis, so the ability to manage the crisis. So one are long-lasting institutional arrangements which show their weaknesses or strength, and others show how your ability and agility, how to react to the crisis. Let me classify some policy actions, and we will come back to these policy actions in much more detail. I just want to give a broad brush classification. So the policy actions, the interventions on the fiscal side and on the monetary side can be very much focused on the firms or on the households. So these are different ways to focus on it. They can be very targeted or very broad brush. And there's also something in between, which Craig Mankiw's idea, where he said, oh, you can do some ex post targeting. You give broad brush support now, and like later on, you would then ex post ask for the money back for people who really didn't need it. But that causes all other questions, and some people might not spend the money or might not use it, fearing that they have to pay back later on. The third categorization is loans versus grants. So you can give some loans. That's often done for many, many measures, also for firms, or you can just give money away. You give grants in a particular way. And the problem is, of course, if you give loans, there's some risk involved. You have to pay back the loans, and there's risk sharing, and people might not pick up on this grant. And we have seen from the last crisis, we had a lot of programs which were very designed, very targeted, but they were not picked up at all. We can also have automatic stabilizers more generally, and that's something probably to go for in the long run. More generally, the question is, if the government wants to support certain parts of society and to reduce the hardship they're facing, how do you do it? One is to directly give households, for example, some money. And there's some argument brought forward that that's now a good reason to have central bank digital currency. That's essentially everybody can have an account with the Federal Reserve or with the central bank. And then it's easy to transfer wealth. Right now, it takes several weeks to send out some checks, and that's complicated. So once we have central bank digital currency, it would be much easier. That's the argument as it goes. You can also transfer to households via firms, and that's the short-term work or this Kurzarbeit, which is very popular in Germany, where the government gives money to firms in order to keep the workers employed, and through the firms, the money is then passed on because wages are still paid afterwards. Or it can also transfer to firms via banks. It's also an indirect transfer, and a lot of this SME lending is going on. But again, you have this problem that banks might not pick up on these programs, might not pass it on, and they might not pass it on to the firms which need it most. And another way to classify is whether you really want to have certain programs in place just purely now for this particular crisis, or you want to have some long-term structural focus to it. So they really want to change how the society is organized, how the economy is organized. So these are different ways, different dimensions we can classify all the different policy actions. About how to channel government support, it depends very much on the pre-crisis governance structure. If you have a government which can easily channel funds through because it's well done. So Germany is very familiar, for example, with Kurzarbeit. So it's very well equipped to channel funds through. If you have to set up a new scheme, it's of course much more challenging. Now let me just conclude my little introduction with a proposal I did for supporting firms. I think there's something to distinguish between large firms and small firms. For large firms, you can, in theory, have some Chapter 11 restructuring. And we know that many airlines and many other firms, they have Chapter 11 restructuring many, many times. And you hardly notice it. It's well done because the management is in place, everything is ongoing. There's not a big difference from that. But you cannot, this Chapter 11 restructuring doesn't really work for SMEs, so for small and medium enterprises. You really need a pause for them. And what's special about this current crisis is that all the policy prescriptions we had for regular crisis, they're essentially inversed. So the do's or don'ts right now. That's why I have this picture where you stand everything upside down. And one particular of these do's and don'ts is evergreening. So evergreening means you just roll over the debt. So debt is becoming due, the firm has to pay back the debt, the bank says, okay, I'll give you the same amount of money to pay off the old amount of debt. And typically, we want to avoid this evergreening because evergreening is essentially just keeping non-productive firms alive, and we would like to have the funds available to promote new startups, new firms, and don't crowd out the new firms by funding always old, less productive firms. As you know, people have experienced in Japan, and otherwise we have the zombie firms promoting. But now we have a very different situation. Now the Fed is not lowering the interest rate in order to stimulate some spending or investment. Now it's all about, stabilizing the existing businesses and making sure that they survive. So now you really want to promote the evergreening. So it's very different from a standard recession. You really want you want to promote evergreening. And what we proposed here is a particular way, I won't go into details, how the Fed could help and the banks to pass on this funding and do some evergreening because they can refinance themselves very cheaply, but then at the discount window or some funding vehicle through the central bank, the Federal Reserve, in the case of the United States. So that's one way to go there. So I want to conclude with a little poll, and Joe will talk a lot of issues will be related to the healthcare industry and the health more generally. And I want to come back to an earlier webinar we had with Angus Deaton, where he outlined two scenarios. So the current crisis will be for the healthcare industry. It might be that they will be seen as heroes at the end. So doctors and nurses will save life, and they will be seen as heroes. The pharma industry will create very quickly some vaccine, and everything will be seen. So or it will be the villain scenario. So we have the villain scenario where the pharma industry is overreaching. They charge large medical bills, and many parts of the population will be sitting on huge medical bills, and the social fabric might be undermined. So the question is, which one of the two do you think is more likely? I would like to ask you. And the second question I would like to ask you is that the sick leave policy in the United States. Do you think in the United States it's more like the case that workers go to work because they have to go to work in order to make enough money for their income, and they can't stay at home, and then they don't internalize by going to work, they make their co-workers sick and cause an externality on the co-workers? What do you think employers will internalize this externality and send workers home? Because for the employers it's of course very bad if all the employees fall sick and make each other sick. So which of the two do you think is more likely, just to get some idea? So just if you give us some votes, we will look at the results. So with regard to the first question, the hero scenario versus the villain scenario, 63% actually think that the hero scenario is the more likely outcome. Doctors, nurses, and the pharma industry will be seen as heroes after the next crisis. And only 37% think that the villain scenario will be the more likely outcome, and the pharma industry will overreach, charge huge medical bills to the population, and there will be social hardship because of that. Concerning the second question, the majority think, 72% think that workers probably will go to work and they don't internalize the externality because they have to make the ends meet. And that's a problem in the United States, while only 28% think that employers at least will internalize and send their workers home. So that's a first outcome. Let's see how this opinion will stick after Joe has given his presentation. So that's the end of my introduction, and now we go on with Joseph Stiglitz, who will give us his view about how to evaluate the US response to the COVID crisis. Joe, the floor is yours.
Thank you, Markus, and thank you very much for putting on this webinar series that I've learned a lot from, and I've raised a lot of interesting issues. The talk I'm going to give on evaluating the U.S. policy response to COVID-19 is based on an issue brief that I've written for the Roosevelt Institute and was supported by the staff at the Roosevelt Institute. The crisis has illuminated a large number of very interesting research questions, and I'll try to comment particularly on those as I go through my discussions. But first, a few introductory remarks. There is first a high level of uncertainty about the course of the disease and its economic implications. At the very beginning, there was a widespread presumption it'd be short, 2 or 3 weeks. Now the consensus is it's much longer. At the beginning, the hope was a V-shaped recovery. Now people are talking about a U or a W-shaped recovery. All this means very strong implications for the economy. The fact that there's such a high level of uncertainty means that it's important for there to be, in the design of the policy instruments, a high level of flexibility and adaptability, and in particular, a high reliance on what I call index programs, where expenditures are linked to outcomes, the evolution of the economy. For instance, I'll talk a little bit later about aid to state and local governments. It should be linked to the deficiencies in their revenues and to their incremental costs associated with COVID-19. We don't want to have what we've been going through, having to go back, you might say, feeding at the trough over and over again. And every time a new political controversy, new opportunities to put in hundreds of billions of dollars of special interest tax benefits, which undermine the effectiveness of the program and undermine trust in government. The second point highlights what you said in the very beginning. The crisis has revealed multiple market failures. And I think an important research question going forward is to try to understand the market failures. What assumptions of the standard model are causing these market failures? The lack of resilient, diversified supply chain, short-sightedness, and probably most disturbingly, the inability to respond quickly, even to the production of a simple product like masks. Normally we think of the market as being nimble. That's why we turn to it. It's obviously not acting in that kind of way we would have hoped. But there are also government failures, but I think the way you ought to think about the government failures are linked to the longstanding attempt to denigrate the role of collective action and denigrate the role of science. Every year for the last 3 years, there have been proposals by the administration for 30% cuts in the science budget and cutbacks in CDC. One of the concerns, obviously, is that restoring confidence is going to be important. That will require transparency, and several of the programs that have been put into the recovery packages are marked by a high level of lack of transparency. The next slide. The decisions about who gets money and on what terms will shape and distort the economy for years to come. The government is really involved in life and death decisions for the enterprises. I think the kind of thing that Markus talked about, an evergreening proposal to get the government out of those life and death decisions, is an interesting way of trying to have the government step back from the kinds of decisions that it's been making. And I'll say a little bit more about that later. But an interesting article that just came out today by Peter Orszag, who used to be the head of OMB, points out that the money is disproportionately going to large enterprises, and we are in the process of reshaping our economy with more inequality, advantaging the large enterprises relative to the small. And the final point is that the crises and their aftermath tend to be moments of intense distributive conflict. And we should expect nothing less. And how these distributive conflicts are resolved will have profound effects on our society. And we are already seeing that in the battles for how the money gets spent. The banks, the large businesses are among the winners, and obviously the low-income individuals, the states, higher educational institutions are the ones that so far are among the losers. Let me go, next slide. So in talking about the responses, it seems to me makes sense to begin by thinking about where we were before the crisis. We had high levels of inequality. We had a weak system of social protection. These weaknesses were reflected in low levels of life expectancy, high incidence of health problems, the kinds of things that Case and Deaton have done such a good job in exposing in their wonderful book, Deaths of Despair. Low levels of health insurance coverage, few hospital beds relative to the population. And the real concern, of course, is that the way we manage this crisis is going to exacerbate these inequalities. COVID-19 is not an equal opportunity killer. It's going after those with weak health, those who are not in a position to protect themselves, and I'll talk about that a little bit later. And that means that the incidence of the disease has been particularly hard on those at the bottom and people of color, African American and Hispanics. The next few slides just go through very, very quickly, just highlighting some of the weaknesses in the US. The death rates in the United States are much higher than in other countries. The blue is the US. And the next slide shows another picture of deaths in the United States for under age 70 and for the population as a whole. Again, the US is so much higher than in other countries. Next slide. This shows, again, a stark difference between US and other advanced countries, much lower life expectancy, and it shows the decline in life expectancy. Next slide. This shows health insurance coverage, obviously lower than others, where the right to access to healthcare is viewed as a basic human right. Next slide. And this shows that after Obamacare was passed, we succeeded in bringing down the number of uninsured dramatically, but that since Trump has gotten elected, the number of uninsured has gone up. This is all background for thinking about the government programs to address the crisis. And there are next slide. There are three, we can, I'm sorry, I left that out. US has also markedly fewer hospital beds per 1,000 people than the average of the advanced countries. So in a way, this is part of, we prided ourselves on efficiency. We used, we made sure that every hospital bed was fully used, but that meant we were less resilient. It's like cars without spare tires. We had a healthcare system without spare tires. And of course, that makes it much more difficult to respond. Next slide. So these are all background for thinking about the government programs to deal with the economy. And there are three aspects of this. The first is obviously not only dealing with the economy, but with the health issues. There is going to be an interaction between the ways in which we what our programs do and the extent of the disease, contagion or not. The second is to protect the vulnerable. And the third is to ensure conditions of a robust recovery. And what I'm going to try to explain is that actually, in spite of the magnitude of the expenditures, it looks like the programs have failed and on all three accounts. Next slide. So I'm going to go through and talk about each of these in turn. I won't go through all the aspects of these because each of these has a number of different ingredients. In some ways, the fights over the programs to maintain health are the ones I find least able to understand. Because obviously, when you have a public health issue, when the disease spreads, it threatens the well-being of everybody. It's prey to inferior. And yet, we've had a lot of fights over these programs. The first issue is one that Markus highlighted in his poll. We don't want people who are sick going to work. And the US has the poorest provision of paid sick leave of any of the advanced countries. Only 30% in the lowest decile of the population. And a lot of these are the people on the front line, the delivery workers who get exposed. Only 30% have paid sick leave. Congress, in a sense, recognized the importance. It passed a mandatory paid sick leave, but then it gutted the bill by exempting about 80%. All those with employers with more than 500, as well as small employers. And that really speaks very much to the question that Markus asked. The big companies did not want to provide sick leave, even limited to COVID-19 illnesses, which to me is really quite remarkable. Really clear that they did not in any way internalize the externality that they were imposing. There are other issues dealing with undocumented workers, making sure that people have access to healthcare. One thing that I think is particularly disturbing is regulations that would make sure that frontline workers had protective gear like masks. And OSHA under Trump has refused to impose these as basic safety standards. And it's interesting here in New York, some of the unions have been strong enough to demand the protections, but in other areas where the unions are not so strong, that has not happened. Next slide. There are a couple basic aspects of underlying economics which should be obvious. Contagious disease are about externalities. very interesting aspects of the mathematics of contagious disease. Don't have time to talk about, but the nature of an externality is that individuals, employers, incentives are not aligned with those of society. That's why you need government intervention. When people interact with other people, they don't take into account the social cost that they exert. In some societies, people may do that better, just like in some societies, people litter less than in others. But it's very clear that has not been the case in the United States. But the second aspect is that workers don't have bargaining power. And we saw that in the point I made before about these employers with over 500 employees. They should be given protective gear. They should have paid sick leave when they have COVID-19. And in fact, the employers treat them as if they were disposable commodities. The third thing I think that has not gotten as much attention and would be a talk on its own, I hope you come back and talk about it, is the intellectual property regime, which has long been recognized not to promote access to medicines, vaccines, other products. And right now, it appears to be part of the problem. The N95 masks are covered by numerous patents, and the administration seems unwilling to use compulsory licenses to make these more widely available.
Jody had several questions on this issue. So would you agree? So Vinit Sharma wants to know whether intellectual property rights by the big pharma industry is a major inefficiency during the crisis. And then Sayantan wants to know whether you agree with Angus Deaton that the low insurance rate in the US is because of the healthcare lobby and some other socioeconomic linkages, and explains that.
Well, I mean, clearly, the failure of our country to have a system of universal healthcare is a result of the lobbying of the healthcare and insurance industry. We saw that in real time, and I saw when I was in the Clinton administration that kind of lobbying. And you know, the programs that we have may not be ideal, but they were intended to move us towards universal access to healthcare in one way or another. And the lobbying has been enormous stopping that. The most telling provision was under Obamacare. There was a public option that would make sure that no matter where you were in the country, you could have access to Medicare if you opted for it. It wasn't forcing it, but the private health insurance companies did not want competition from the government as an option, not a compulsion, but an option. And that is what really explains what the most important reason we don't have healthcare. IPR is, I think, going to be even more of an impediment if we don't use compulsory licenses. And it's going to be a real problem in developing countries in access to vaccines and antivirals. We have provisions within the TRIPS agreement for compulsory licenses, but governments have to be willing to use those. Next slide. The second objective of the programs is protecting the vulnerable and maintaining workers linked within the workplace. Again, the US preconditions were worse. We had a poor system of unemployment insurance, both in coverage and replacement. But the broad consensus that the most cost-effective way of providing assistance and setting a precondition for recovery is to maintain the link with the employer. It avoids the cost of rehiring, the retraining. Earlier research has shown that displacements, furloughs are associated with large hysteresis effects, lowering wages and by implication productivity over the long run. And this is especially important in the US, where a majority depends on employer-provided health insurance care, and switching from that into a Medicaid would be a major disruption. But as we all know, the US performance has been, even though several of the programs were intended to maintain the workers' link with the workplace, it's obviously failed, with 24 million newly unemployed and the highest increase within the advanced countries. The next slide. The next two slides show the US has a very low level of protection on unemployment insurance, the worst of the advanced countries. And what US has after 6 months is particularly low. And the next shows the replacement rate, next slide, is also particularly low for the United States. The next slide. The next slide shows the increase in unemployment in the United States compared to other advanced countries, markedly higher. And in that list are countries like Italy that have had obviously been very badly afflicted by the COVID-19.
Isn't this a little bit distorted because you have the short-term work where in many countries firms are paid to keep their workers on the payroll, while in the US they're laid off and then they get unemployment benefits?
In the case for Germany, that's clearly the case, but this is true. You know, you look at different countries with different programs, and I'm going to come explain why this is. You know, it is. I think it has a lot to do with the design of the programs that we put in place, and I'll try to explicitly address why they haven't worked.
There are a
number of other factors that go into this.
One person in the audience would like to know whether the federal structure in the United States was really making things worse. So the fact that everything is organized at the state-by-state level, or many things are organized at the federal, not at the federal, but the state-by-state level, was this a hindrance to get a quick response?
I think the critical thing I'm going to put my finger on is the federal programs. It is clear that the reliance on state programs has been a problem. Some states like Florida have not updated their software for years. That was a whole, they were trying to make people were not getting unemployment insurance. So that's clearly contributed to the problem, and that's part of the preconditions that I described before, that we didn't really have a good unemployment insurance system, and that's partly because it was relying on the state. But the rescue packages are also deficient, and that's what I want to focus my remarks right now on. Okay. So explaining the failures, the problem is that the programs were not comprehensive. They were not well targeted. They were shaped more by who had the best lobbyists than an analysis of where the money would be most effective in dealing with unemployment with the people who were most vulnerable. And you see that as an example in what's going to be a big problem, failure to give money to state and local governments, which has become at the center of controversy. And I'll come talk about that explicitly. The most controversial program is called the PPP program, which was intended for small business. And it was particularly poorly designed. And I'll talk about it because it, in a way, illustrates all the failures of the program in a sort of a encapsulated way. It had high administrative costs. The banks were the intermediary. They're getting about 1%. That means they're getting to administer a program of about $7 billion, $700 billion. They're going to get $7 billion just for transferring administrative electronic information. They're not vetting. They're not really responsible for risk. It's just a electronic intermediary. But the real problem with having banks as intermediaries, the money went to those who were good customers of the banks, construction firms, large firms, not the most vulnerable. McKinsey did a study of what were the most vulnerable industry sectors, and you look at those and you look at where the money went, and the two are not aligned at all. 4% of the loans, which are the big loans, accounted for almost half of all the money. On the other hand, the loans that went to small people accounted only for 17% of the funds. And a number of got loans of more than $5 million, totally out of keeping with the intent. Next slide. There were some further problems. One that was not really anticipated was the lack of trust. There are provisions in the program of loan forgiveness if the employer retains his workers. And that key provision that was thought would keep the link between workers and their firm. The problem is that many firms, we've heard, did not trust the government promises of loan forgiveness. There was a worry that in the end they would find some picayune reason to say, oh, you violated this provision or that provision, and so that the small businesses would not, in fact, get that loan forgiven. And many used the money just to build up capital buffers. There's been a lot of lack of transparency, and probably the most interesting, most important, is this lack of prioritization. The first tranche went off in a few days, and they're expecting the second tranche to go out in a couple of days to be exhausted. And with money so scarce, there was a real need to identify where money would be most effective. And that actually is related to an interesting set of research that I've been involved with some colleagues of mine on asking, it's analogous to the question, if the government is going to have limited funds to bail out banks, and banks are connected in networks, how do you identify the banks that are most central, whose death would be most damaging to the economic system, or whose net cost to the government, to our society, would be highest? And there's a series of papers that we've done where we've identified that, and we're now working on a similar kind of question. Can we identify what sectors of the economy would be most critical for getting money, especially if you put weight on individuals who are most vulnerable? Next slide.
So can I ask you some questions?
Sure.
Markus Miller would like to know whether you say something to Super Chapter 11. You proposed
I'm coming to
earlier.
that. Great question, Markus. And Markus and I have a paper that we wrote on that subject. So I'm going to...
A particular application to the pharma industry, for the healthcare industry.
Yeah, very much so. So there were alternatives, and many of the European countries chose those alternatives, which entailed giving money directly to employers who maintain employment. We have, you know, the IRS and the Social Security Administration has electronic interfaces with every company, and they know the data on the employment. There are a proposal from Representative Jayapal and a proposal from a group of senators. There have been cost estimates of this alternative, and it's a fraction of the cost of the PPP program, roughly between 115 to 150 billion dollars, depending on the parameter that you chose. And the programs are comprehensive. They don't entail banks or SBA picking winners, which sectors to go to. Next slide. So the point is that though we spent $2.7 trillion, it won't be enough because it was so badly designed and targeted. And as I said before, the whole mindset was it would be a short program, and now it's very clear it's going to be a long-term program. That raises the question, the debt GDP ratio is already estimated to be 101% by September, according to data just coming out from the CBO, and the deficit of around $3.7 trillion is going to be around 18% of GDP. And in some of the previous sessions, there have been some concerns about whether this will lead to inflationary pressures. I want to come back to that at the end of my remarks. And in spite of all this money, there are some important emissions. The first I want to mention on this slide, I feel a little bit self-serving, but I think it's actually true and important. The education and research institutions, revenues are down. The amount of money that would be needed to keep them whole is really very, very small. There was an article in the FT giving an estimate of like $26 billion shortfall, but the social cost of not providing that support could be enormous. Next slide. The other major emission is state and local government. And here, the point is very clear. We saw the 2008 crisis, tax revenues declines were almost twice that of GDP. The states have balanced budget frameworks. That means when their revenues go down, they have to reduce their expenditures. They're very labor intensive. And so the implication of all this is that we have built-in austerity at the state and local level. We've seen that play out in other economic downturns, in the Great Depression, in the Great Recession. And important thing is the Fed lending facility doesn't solve the problem because it's a constraint they have. If you look at the timing, it's likely to show up just when we're, because of the lags, when we're trying to get out. And these expenditures are really key to education, welfare, and social protection. Next slide. So that comes to the third major aspect of the programs, establishing the conditions for strong and quick recovery, and a lot of attention on providing liquidity. Massive amounts going to corporations. The big lacuna is households. They did some things, government insured programs, student loans, for government student loans, but many others were left out. Credit card debt, car loans. In a sense, the rest of the country was put on hold, and banks continue to collect interest. It's especially problematic with usurious interest rates and fees. and the balance sheet effects, I'll come through that in 1 second, can be disastrous. And already the symptoms are showing up. The failure to pay their rents at the end of last month was already almost double what it was in previous years. So I want to in my talk with paying attention to 3 critical tasks for recovery. Next slide. The first of these is the standard macro models. They could act with a vengeance. I'll explain why. The second is avoiding debt spirals and bankruptcy cascades, the kind of thing that Markus talked a little bit about. And finally, managing supply chain problems. So let me begin with those. The macro models, multipliers, next slide, are straightforward. But what I want to emphasize is just 2 points. One is the balance sheets of firms, households will be hurt very badly. And the second thing is there's going to be an increase in uncertainty. We're clearly off an equilibrium path, little uncertainty about the future course of the economy, and that will induce precautionary behavior. So the two together, the adverse effects on balance sheets, the increase in precautionary behavior, are inevitably going to have a very big effect on aggregate demand. And so while this crisis began as not a deficiency in aggregate demand like 2008, it was a COVID-19 crisis, an interruption in supply and demand, it will morph into a standard aggregate demand deficiency unless we undertake the right measures. And we have to remember that the multipliers in deep downturns are very large. One of the things that came out of the empirical research that was done in the aftermath of the 2008 crisis. Next slide. The second big issue are the debt spirals that I saw very vividly in the 1997 East Asia crisis. And these can result in financial gridlock, bankruptcy cascade. The idea is if A doesn't pay B, B can't pay C, C can't pay A again. You have a network of financial liabilities, and they can give rise to systemic bankruptcy. And in the case of the East Asia crisis, it was 70% of the Indonesian firms, 50% of the Korean firms, and almost 50% of the Thai firms. And when you have this systemic bankruptcy, gridlock, it's very hard to resolve. It's a complex interdependent system. The mathematical problem of resolving it has actually only recently been solved. And it's particularly important, complex when there are bankruptcy costs, of course, and those can be very large and been well identified. And this is where I talk about what Markus raised, the super chapter 11. Markus and I, back in the East Asia crisis, said that, you know, chapter 11 provides a framework for dealing with it on a case-by-case basis. But when you have so many bankruptcies, you need a different set of presumptions, and you need to do things very, very rapidly.
Can you explain it? How would it work?
Oh, it's just a different, it's very much like chapter 11, but chapter 11, unfortunately, doesn't work very quickly. So chapter 11 allows each of the parties to submit their proposals for how you resolve the inability for the debts to be paid. And the point is, in the period while that is being addressed, the firm is on hold, assets get stripped away, and because A depends on B and B depends on C, when you have this gridlock, if A is in this limbo, then B is in limbo, then C is in limbo. So that means that the trade-off between perfection and speed changes dramatically when you have a systemic bankruptcy, systemic gridlock.
So, but who oversees it and who
Evergreen
manages?
proposal.
Who is overseeing the procedure, the super Chapter 11 procedure?
Oh, you still need the courts. You still need to have, but it's a change in the presumptions. It says, you know, ongoing management, if it satisfies a certain level of legal, goes ahead, and others can make objections, but there is a burden of proof that's higher to stop the resolution in terms of, you know, sort of like prepackaged bankruptcy.
Would you, so as a question, would this be international or just country by country?
Oh, this is, I was addressing this for the United States, but this is a problem that will face many, many countries. And there is a similar kind of problem in sovereign debt. The risk of sovereign debt cascades going around the world is also serious, but that's another topic that I don't have time to talk about, okay? So let me just do the last one and then we can open up for questions. The last two slides. The third set of problems have been talked about in a couple of your webinars, and these are supply chain problems that it's not just a demand problem, and that's why for now, referring to these programs as a stimulus is a misnomer. It's lack of supply, it's a shutdown of production, and that will, in a, you know, sort of a reversal of Say's law, that will create its own lack of demand in the way that I've just described a few minutes ago. But it could eventually see shortages in important products, and we're already seeing some shortages in tests, in masks, and these shortages can be extended to food supply. You had a good webinar where we talked about interruption of the global supply chains, especially if some countries worried about shortages impose export restraints. And we noticed in one of your earlier webinars, the irony of the United States, even though it imports more than it exports on critical healthcare supplies, was talking more than other countries about imposing export restraints. But the important point is that there are large changes in the structure of demand, at least in the short run. Now, people aren't going to be doing airlines, aren't going to be going to theater. As we've seen in the context of structural transformations, markets often don't manage these changes well. There's an important intellectual question, theoretical question, how do we explain this? Obviously, capital market imperfections are part of the story. The sectors that are weak are the very sectors that don't have resources to be able to move into others. Absence of risk markets is part of it. Behavioral economics is part of it. Next slide. This is the final slide, and I know you want to end by 1:30 or 1:35, so the supply shortages combined with the enormous increases in liquidity and big government deficits are naturally beginning to raise among economists worries about inflation. It's not very much in the popular press, but in some of the previous webinars, there were hints of people beginning to be worried about this, the discussion about wartime deficits and how they were managed. And I just have two brief points. One is there are going to be these shortages, and we should consider government interventions in the production and distribution of essential goods. Actions that, had they been taken earlier in the case of masks, protective gear, and tests, might have saved a multitude of lives. So we have to, you know, I began my discussion saying there's a lot of uncertainties, and we don't know. If we could be sure that this was going to be over in another couple of weeks, we could say, don't worry about this. This is just a short interruption. But if it goes on, there can be significant effects, in particular commodities that are very important, including certain food commodities. The second point is the worry that the imbalance of supply and demand will lead to inflation. Let me say my perspective is these should not impede the current efforts. As I already said, the most likely outcome in the immediate aftermath of the control of the pandemic itself is still going to be the deficiency of aggregate demand. And that's because both of so many balance sheets are going to be on both corporate side, household side, firm side are going to be weakened, and there's going to be enormous uncertainty. We're not going to ever, people will worry, will there be another episode? So we are going to be facing an increase in precautionary behavior, and consumption will be weakened, investment will be weak. So the most likely outcome I see is in the immediate aftermath of the pandemic is a deficiency of aggregate demand. So we may have to think of even more deficit spending, basically a form of socializing risk. But we will have to monitor what's going on very carefully with a readiness to raise taxes. And of course, my view, given the inequalities, given the weaknesses in our system before, these will have to be progressive taxes, environmental taxes, and possibly tighten monetary policy. So to me, economists should always keep in mind all the risks going forward, but I don't think inflation is something that we need to put at the forefront of our mind. I think deficiency of aggregate demand is a far more likely problem, but we will have to monitor things very carefully.
Thanks a lot, Joe. So I have several questions. I will put it into 4 blocks, if you don't mind, and we can
Sure.
Answer each block very briefly. So the one block is about inflation, and some people want to know what's your take on QE in this environment. Do you think it's very useful to QE? And the other question is a little bit what came up also last Friday, is that what's different this time around is there's huge fiscal expansion. So it's not only on the monetary side, and it seems like when you say you have to raise taxes, you also subscribe. It's not necessarily central bank which has to act, but it is the fiscal side which has to do something. And if you really want to kill off inflation, don't you have to tax the people with the highest marginal propensity to consume? So rather than imposing taxes on the rich, which we both favor, but you have to impose taxes on the people with the highest marginal propensity to consume, just to play a little bit devil's advocate.
Okay, so on the second, no, the answer is it may take more taxation of those in the top to get the same diminution of aggregate demand. You're right about that, but we'll be entering a period where we have, for those who worry about these things, a very high debt GDP ratio, and all the more reason to get a lot of tax revenue in to address the overall balance sheet of the country. And unlike, a lot of us said we should never just focus on the liability side of the government's balance sheet, but this is like a war where you wind up with a lot of liability. without the assets in terms of infrastructure or technology to show for it. So you might make a more compelling case than you do in other cases to say this is time to use that progressive taxation to really correct, to both tame excess demand and to correct the balance sheet problems. And a lot of what's been done, and it came out in this article I mentioned by Peter Orszag, that so much money is funded corporations and the billionaires beginning in 2017, you might say it makes a lot of sense to correct that. QE is not going to address lowering interest rates from 5% to 1% didn't provide much stimulus of the economy. And we know why. The interest elasticities tend to get very low when there's a high degree of uncertainty. This is a period when there's a high degree of uncertainty and a very big balance sheet effects. So I don't think QE is the appropriate instrument. It will have to be more fiscal policy. And I think there's a lot of scope for fiscal policy because of the deficiencies in our overall economic framework that I talked about at the very beginning of the talk.
So Laurent Calvé would like to know something on the financial side. Shouldn't we build up a system which is more resilient in the long run? And how can we do this in a world where finance is very much short-term focused? Do you have any recipe for that?
Yeah, that's a great question. I mean, one of my critiques in the beginning is that our economic system has been insufficiently resilient. And, the natural question is why? And I think the natural answer to that is, can be put in a couple of different ways. You can talk about short-termism in the corporate sector. You can talk about the absence of error degree security so people don't adequately evaluate the risks going forward. There are different ways of saying the same thing. I think in terms of policy reforms, one of the things that one needs that might correct the problem are the loyalty shares that Patrick Bolton and some other people at Columbia Business School have been talking about, where you basically incentivize, you say that those people who have long-term interest in the corporation get more voice. There are a number of other ideas along lines. For instance, giving more scope for development banks that think more long-term, that give money to those who are thinking long-term. And that's why in New York State, we've created a climate change bank because markets were not thinking long enough term in that respect. A third important change is in our system of legal liability, fiduciary responsibility. In the United States and in many other countries, fiduciaries are not allowed to look at the long term. They're supposed to look at the short term, what is maximizing market value today. And that almost that encourages short-termism. And there's an argument that we ought to flip that around. And pension funds, sovereign wealth funds, and the legal framework should encourage fiduciaries who, especially fiduciaries like pension funds who have a 30, 40-year obligation, to explicitly look at the long-term consequences of the firms, of the actions of the firms in which they are invested. So that will actually put more focus on the long term.
So let me group all the final questions together. So Robert Owen and others asked about the social contract. How do you see the social contract evolving? And Spain introduced some elements of universal basic income. Are you in favor of just broad brush subsidies. And there are probably distributional effects you mentioned initially from all the programs. So the government has to pick some winners. Should the government pick winners based on national interest, strategic national interest? And the final question I want to throw in is like, should we suspend competition for the development of a vaccine, just to make sure that, you know, the pharma companies work all together to develop very quickly a vaccine? It's a little bit out of the order, but I just want to put all the
Sure, there are lots of good questions there. I'm sorry, I'll have to be very brief. I think clearly there is a need for a new social contract. It was one of my, the thesis of my recent book, People, Power, and Profits. But I think the crisis is going to bring that home in a very forceful way. The reason particularly is people have become very aware that the people who are being brought down by the crisis are the frontline workers, the low-income workers, who even people in the healthcare sector who are providing enormous services, but many of these people do not get adequate pay. And somehow there seems to be, you know, anybody who believes in margin productivity says, well, let's look at the social margin of productivity. What have they contributed? And is the compensation that they're getting anywhere commensurate with what they've done for all of us? And I think a lot of us feel that there's obviously, this crisis has really exposed that gap. And exposed the gaps. You know, I mentioned before the lack of protective gear for these frontline people is really quite stark. So it's also highlighted the importance of externalities, the importance of the fact that people without bargaining power are those who are suffering the most. This is not a competitive equilibrium in the usual sense. Bargaining power really matters. And so it's highlighted all the deficiencies in the market and how we haven't been able to address that. And that's why we need a new social contract. My own feeling on UBI is that when I think of all the things that need to be done in the next 20 years, the green transition, constructing our infrastructure, constructing access to healthcare for all. You look around in the United States, you look around the world, and the view that I have is what our emphasis should be on making sure that there are jobs, paying decent wages for everybody who is able and willing to work. And obviously, in the midst of this crisis, we are having UBI. We're giving money to everybody because there's no alternative. Work is not a possibility. And so the current program, which is a version of a temporary UBI, makes a lot of sense. But for the long run, our focus should be making sure our economy works and providing jobs for everybody who wants it. The issue of providing vaccines for all is very much linked with the issue of IPR that I talked about in the beginning. The Gates Foundation is doing an amazing job on this. They're going ahead, and it's very clear that we will probably get a vaccine, but there are several different vaccines that are in the trials or about to begin trials. And they recognize that if we wait to find out, it will delay the production of the vaccine by months and months, during which thousands of people, tens of thousands of people will die. So my understanding is they're going ahead and building factories on each of the major technologies, and then one or the other will pan out. I think that's a really it's the kind of thing government ought to be doing, but our government isn't stepping up, and didn't step up when we needed taking strong actions, and now is not stepping up and making sure that we have the vaccines. This is really a global issue, and in which everybody in the world has a stake. And unfortunately, my conversations with people in the scientific community are very worried that while other countries are acting in a very cooperative way, America's me first, America first, is less than fully cooperative. And well, obviously, you know, one of the important things about thinking about this from a global point of view, it's a pandemic, and we won't really fully address either the health or the economic implications until we address it in every country around the world. So this really is a case of a global public good, a global externality that has to be addressed in a global way. And the intellectual property regime may impede it unless governments are willing to use the compulsory license provisions that are part of TRIPS, but which have been undermined over the years, and in which, unfortunately, the US government has, in a bipartisan way, has opposed developing and emerging markets using those provisions when it comes time for them to make medicines affordable, accessible to all. So I think there needs to be, at least for this emergency, an agreement that compulsory licenses should be accepted as the norms. And of course, those who are spending research have to get adequately compensated for that. That should be a given, but that's not the way to provide that's a way to say, if you're going ahead and doing research, we will support you. But in the end, we have to make sure that there's access to medicines for all.
Thanks a lot, Joe. This is a nice segue to our next event on Friday at 12:30 New York time, where Michael Kramer will actually talk exactly how to induce companies and how to design the system in such a way that everybody is producing new vaccines and diagnostic devices. So it was a feast to cover all the different aspects of the program. And I would like to do a little bit of advertising for next Friday already, which now we have covered to some extent. And I know that you've written on this topic as well. And I hope to see you all on Friday again. If you want to check it out, check out the website bcf.princeton.edu. You find all the speakers, and you will also find today's YouTube link once we have done it. So if you have missed it, you can still watch it afterwards. Thanks a lot, Joe. It was a pleasure to have you. And
Thank you.
Hope to chat with you soon again. Thanks.
Great. Thank you.